The coronavirus pandemic began quietly in December 2019 in the city of Wuhan, located in China, when local doctors noticed an unusual cluster of pneumonia cases that did not respond to standard treatment. At first, the outbreak seemed limited and uncertain, but within weeks, scientists identified a new coronavirus later named SARS-CoV-2, and the disease it caused became known as COVID-19, a name that would soon echo across every continent. By January 2020, cases had begun appearing outside China, carried by international travelers before strict screening measures were in place. And as the Lunar New Year migration intensified movement within and beyond China's borders, the virus silently expanded its reach. Governments initially attempted localized containment, a human mobility, asymptomatic transmission, and delayed global coordination allowed the outbreak to accelerate into a worldwide emergency. On March 11, 2020, the World Health Organization officially declared COVID-19 a global pandemic, marking the moment the crisis shifted from regional concern to a defining event of the 2020s decade. The speed of transmission stunned public health experts. COVID-19 spread primarily through respiratory droplets and airborne particles, meaning everyday activities, talking, breathing in enclosed spaces, commuting, attending gatherings became potential channels of infection. And because many infected individuals showed mild or no symptoms, silent transmission fueled exponential growth in cases before testing systems were fully established. Hospitals in major cities soon faced overwhelming pressure. Intensive care units filled rapidly. Ventilators became scarce, and healthcare workers labored under exhausting and dangerous conditions, often reusing protective equipment during early shortages. Images of overcrowded wards and temporary field hospitals emerged from multiple countries, while refrigerated trucks were used in some regions to store the bodies of the deceased when morgues reached capacity, illustrating the human toll in stark and painful detail. By mid-2020, lockdowns had become a common response strategy. Entire cities shut down public transport, schools closed. Indefinitely, international borders tightened, and billions of people experienced restrictions on movement, unlike anything seen in peacetime modern history. Official statistics eventually recorded more than 7 million confirmed deaths worldwide, though epidemiologists studying excess mortality estimated the true number of lives lost may have reached between 15 and 20 million or even higher, accounting for underreporting and indirect deaths caused by strained healthcare systems. This made COVID-19 the deadliest global health crisis since the Spanish flu, and in many countries, it became one of the leading causes of death during peak waves. The United States recorded the highest number of confirmed fatalities, exceeding 1.1 million, reflecting a combination of population size, early community spread, regional policy differences, and waves driven by new variants, while other nations such as Brazil and India experienced devastating surges that overwhelmed hospitals and cremation facilities, and countries including Russia, Mexico, and Italy faced profound loss during successive waves. Italy in early 2020 became one of the first Western nations to impose nationwide lockdowns as cases surged in Lombardy, offering the world an early warning of how rapidly healthcare systems could collapse under exponential spread. Beyond mortality, the economic shock was immediate and historic. Global stock markets plunged in March 2020. Supply chains fractured as factories closed and shipping routes slowed. Tourism and aviation nearly halted, and small businesses struggled to survive prolonged closures. Governments introduced massive fiscal stimulus packages to stabilize economies, provide unemployment support, and prevent financial collapse, while central banks cut interest rates and implemented emergency measures to sustain liquidity. The crisis accelerated digital transformation, pushing millions into remote work arrangements almost overnight, reshaping corporate culture, urban commuting patterns, and even long-term real estate trends as people reconsidered the necessity of physical offices. Educational systems also shifted dramatically, with schools and universities adopting online learning platforms. Though the transition exposed deep inequalities in internet access and technological resources, particularly in low-income communities. Socially and psychologically, the pandemic left lasting scars. Prolonged isolation contributed to rising anxiety, depression, and feelings of uncertainty. Domestic tensions increased under lockdown conditions, and frontline workers endured trauma from sustained exposure to severe illness and death. At the same time, communities displayed resilience, organizing mutual aid networks, applauding healthcare workers from balconies, and adapting rituals from weddings to funerals to comply with distancing guidelines. Public health messaging evolved as scientific understanding deepened, and debates over mask mandates, school closures, and vaccination policies revealed tensions between individual freedom and collective responsibility, highlighting how a biological crisis could quickly become a political and cultural one. A turning point came with the unprecedented speed of vaccine development. Leveraging decades of prior research into mRNA technology and global scientific collaboration, pharmaceutical companies raced to produce safe and effective vaccines in less than a year, a timeline previously considered impossible. In December 2020, vaccines developed by Pfizer in partnership with BioNTech and by Moderna received emergency authorization in multiple countries, followed by other formulations, including viral vector vaccines. Mass vaccination campaigns rolled out in 2021, prioritizing healthcare workers, the elderly, and vulnerable populations. And although global distribution remained unequal, wealthier nations secured large, early supplies, while many developing countries waited. Vaccination significantly reduced severe disease, hospitalization, and death rates where coverage was high. New variants such as Alpha, Delta, and Omicron demonstrated the virus's capacity to evolve, each wave bringing renewed challenges and adjustments to public health strategies. But over time, accumulated immunity from vaccination and prior infection reduced overall severity in many regions. Treatments also improved, with antiviral medications and refined clinical protocols increasing survival rates compared to the earliest months of the pandemic. In May 2023, the World Health Organization declared that COVID-19 was no longer a public health emergency of international concern, signaling a transition from acute crisis to long-term management. Though the virus continues to circulate endemically, and periodic outbreaks still occur. Historically, the pandemic will likely be remembered not only for the lives it claimed, but for the structural changes it accelerated. Governments reassessed supply chain resilience, invested in domestic vaccine production, strengthened epidemiological surveillance systems, and reconsidered emergency preparedness strategies. Individuals re-examined priorities, work-life balance, and the fragility of global interconnectedness, while public trust in institutions was both challenged and reaffirmed in different contexts. The coronavirus pandemic began at the end of the 2010s decade, dominated the early 2020s, and reshaped the trajectory of global society in ways that will influence policy, science, economics, and culture for decades to come. It was a crisis born from microscopic particles, yet magnified by human networks, revealing both vulnerability and innovation, division and solidarity, fear and resilience. And in doing so, it became one of the defining chapters of modern history.